Hello again, Dr. Ed Zimmerman, your host on Aesthetic Revolution, the podcast, with my co-host, Staci's Taylor Zimmerman. And today, we're going to go down the rabbit hole a little bit. We're going to talk about growers, showers, turtles, and hiddens, or berries. So lots to talk about in this episode. Micros too, but that's a small percentage, if you will. Pickle speaking. Mm-hmm. So a lot of pickle talk today, and we'll get right into it.
Yeah. Start with shower versus grower. Let's talk about what that is.
So pretty common. You know, the average guy, average genetic inheritance and you know, age and all those things, but the average adult male is probably 5.5, maybe 6 inches long. Depends on which statistics you read, but you know, it tends to be about that when they're on stretch or when they're erect. It doesn't matter because you can't get any longer than Mother Nature makes you. If you could, you'd hang from your ankles every night to get taller, right? And nobody does that. Mm-hmm. So if you're a shower, you're a bit engorged and you've inflated the balloon of the penis. The hydraulics are always a little bit engorged. And so you're a shower all the time. Great for gray sweatpants, encouraging in the gym locker room, things like that. But not everybody is there. A statistically decent percentage, you know, 20, 30, 40%, depending on, it's a moving target, if you will, of guys are growers. And so at any given time, they're not particularly engorged. The penis accordions a bit. They still have that same ability to stretch to 5 to 6 inches. And when they're erect, they're 5 to 6 inches or more or less, depending. But when they're at rest, there's not a whole lot to see. Even guys who are thin, who don't have a lot of suprapubic or pubic fat to turtle or hide the penis, may be growers. And, you know, we do every day, we allow or help growers become showers by putting FDA-approved fillers off-label in the potential space between the skin that slides up and down the penis and the covering of hydraulics.
Real quick, I just wanted to say, when we're talking to men about why they want to do that, you mentioned the gym and gray sweatpants, but really most of them say when they're about to have sex and it's revealed, they want it to look bigger than it does when it's accordioned. So that's really why they're coming in to become, showers instead of a grower, because of that moment in time. They want it to be impressive. Well, and I can understand that.
And even for themselves, you know, when you reach down in the morning, first thing, as you're tootling off to the restroom to get rid of that night's urine, it's nice to reach down and recognize that today's going to be a good day because you've got a stick shift, you've got something to hang on to there. So, you know, it's not infrequent that we have guys who, you know, just want to have more visibility all the time.
Right. So let's talk real quick about how we do that in the office.
So, you know, girth is more important. I think most of our audience agrees is more important than length. The length is what you got. Too much length can be uncomfortable because it can pummel the cervix or cause an issue. The majority of nerves that need to be stimulated for a woman to climax or achieve orgasm are within the first 2 inches or so of the birth canal, the vagina. And so the more girth there is, the more stimulation that those nerves get, and the more stimulation the guy gets as well, because when you have a deflated shaft, the nerves are not really all exposed, and as you inflate that shaft, more nerve endings are exposed. You tend to have more sensation. So that's kind of cool. Mm-hmm. We do that in the office every day for guys with normal anatomy and no underlying significant medical issues. Mm-hmm. It's a fairly non-invasive procedure. So we ask you to manscape a little bit, and the gals will give you some very strong topical anesthetic to put around the base of the pickle. We add some anesthetic before we get going so that you don't feel the pickle for an hour or two. And then we've developed a way to very precisely, with minimal disturbance, if you will, precisely put various FDA-approved fillers around the entire circumference of the shaft of the pickle. From, if you have a foreskin intact, if you haven't been circumcised, we put it from the base of the foreskin down to the base. because we don't want to fill that foreskin out and have it not be able to move back and forth easily. So, we certainly see people who haven't figured that out, who've been elsewhere, and they have an issue. And sometimes we have to do an adult circumcision because they aren't using a filler that's either FDA approved or is going to go away.
Unfortunately, we see a lot of botched jobs.
So we get our fair share of helping people who've had botched issues elsewhere. Mm-hmm. So we've seen a lot, and that we know what not to do. And certainly if you have been circumcised, we can blend that filler down towards the glands of the penis, but that tissue is more adherent, so it doesn't inflate. But we don't want you to have just filler and then a shelf where it stops. It has to blend in naturally, have a nice aesthetic to it. Mm-hmm. But anyway, we're able to put that in. We're able to arrange it so that the filler stays smooth underneath, and we do that over several visits. And then we're able to, keep that grower as a shower so that the filler sets up over the entire length of the shaft, both at rest and when it's long.
Let's talk about the different fillers that we use, or options.
There are, for lack of a better description, there are 4 basic fillers. This all started 25 years ago when I started doing high-def liposuction, liposculpting. I was one of the first 25 docs in the U.S. who went to spend time with Alfredo Hoyos and literally do hands-on high-def liposculpting in Colombia. Mm-hmm. And so thank you, Alfredo. Appreciate it.
And high-def lipo is not new.
Yeah, high-def lipo has been around.
Yeah.
High-def lipo has been around for a long time. But there are people who do it better than others because they appreciate what's going on under the skin. So when we do abdominoplasties and things, we get into all layers all the way down to scarpus fascia. And we do high-def lipo in the shoulders and the thighs and the arms, all those places. It's not just the abs and the traps on the back and the lats. So, but what you leave is as important as what you take away. But when you do take away fat, sometimes you want to graft it into areas to accentuate the areas, to accentuate the elevations and the shadows next to them. And so sometimes fat got into penises. So the original filler was fat. Mm-hmm. Fat can be a little bit variable. Probably 40 to 70% of fat lasts, meaning years, but it can go away. But fat is nice because when your body weight goes up, the fat tends to go up with it, so you're staying proportional, because liposculpting is really a proportioning tool. It's not a cure for obesity or anything like that. As your weight goes down, fat tends to go down too, and it may or may not come back. These days, we're much more sophisticated with our fat because we're into rejuvenative medicine, and fat contains multiples of the number of stem cells, regenerative cells, that we have available in bone marrow. We have more of them in fat. So 500 to 2,000, maybe 2,500 times more rejuvenative cells are in fat than are in bone marrow. So we can take that fat, we can break it down into both a macro fat, which is sort of a building fat, all the way down to a micro fat, a milli fat, a nano fat, and then down to regenerative cells. And we put combinations of those structural versus supportive versus rejuvenative cells and the milieu that contains with it into any fat grafting we do, whether it's on the face with high-def lipo, chest, arms, torso, and penis and tuchus. So, this is sort of, when you put fat into the penis, it's sort of the male BBL. Mm-hmm. And so we're using the fat constructively. We're stripping the fat off of the pubic area. We're really focusing on getting the inguinal folds to really pop out. We're looking at the abs and filling the penis with some fat. You can't get right back into the gym, though, with fat, because some of that structural macro fat will be the first fat that the body goes to as an energy source. Mm-hmm. So it breaks down. So, and not everybody has fat. Not everybody has fat or wants to use their own fat or donate their own fat to make the penis more full. Fat is fickle, and there's some tricks that we've learned over the decades to make it lay evenly, stay smooth, not just flop over to one side. We see a lot of guys who've had fat and it's all congealed in one area, and it's like, what do I do with my, my hump? And So we fix those kinds of things. And we prefer not to cut it out. We'd prefer to even it out and blend other things in. So other things are FDA-approved fillers. And there are three basic categories of FDA-approved fillers. One are hyaluronic gels. So a synthetic version of the substance that lives between the cells of all living things. Your cells, my cells, all of your cells. And hyaluronic gel is sort of a water-based, cross-linked, jello-y moiety that is lovely because it moves so well. We put it into lips, and we put it under eyes and places that have to move and not look bulky when we have emote. And it looks great in penises. It's soft. It can be a bit fluffy, so not everybody likes having that collar of softness around. But it inflates. It just looks like you hit the genetic jackpot, had a good weekend, won your poker round, whatever it was. Everything fills up. And, we use that from the base out towards the tip, depending on whether or not there's a foreskin, as we talked. We don't generally put it in the tip because the tip is part of the vascular space that becomes the corpus spongiosum. So if you want to get a vascular occlusion, go ahead and let your injector inject the tip of your penis without certain precautions. But
no, please don't.
Yeah, please don't.
Please don't. And
we're
please
tired
make
of seeing
sure
slough
that
tips.
your injector
Nobody wants a Snoopy dog.
Is not just an injector of lips and jaw lines, that they're highly skilled and educated on how to inject a penis, because it's not like any other body area.
Yeah, so. And that in their toolbox, in their crash cart for injectables, they have ways of reversing that, because you can.
They better have.
or imaging it with ultrasound and things like that. So we have in our filler crash cart, we have ultrasounds that we use regularly before we would think about needing to have a crash cart, and the other tools available to dissolve or hydrate or break up whatever a vascular occlusion. So lots of things going on there. That's more than a podcast. But anyway, so we get penises filled. Hyaluronic gel is certainly one category. Another category is a calcium hydroxyapatite biostimulator. So about 18 million microspheres per syringe suspended in a methylcellulose carrier gel. Put those two together. I use that in the face for chiseling jaw lines, lengthening chins, making anterior projection of cheeks, filling in temples, putting in the backs of hands to hide tendons and blood vessels, the veins that have become prominent as people lose subcutaneous volume. And we can put it in that potential space between the skin and the covering of the hydraulics in the male member. But we have to be careful, because if we don't keep that straight, if we have a grower and we turn him into a shower, but then the penis gets aquariated a lot, well, it can clump up and it can become fibrotic. And that's not fun, because I can't dissolve that immediately. It'll go away in 9, 12, 15, 18 months. But, ideally we want to put it into the right guy. The right guy is generally a little bit of a shower rather than a grower. And, sometimes we have to turn them into a shower before we can put a longer lasting filler like Radiesse in. So that's kind of a cool thing. And then for guys who want to have something that lasts for years, then we use polymethyl methacrylate, which is a polymer. It's a same polymer that's been used in the past to create artificial lenses for eyes after cataract surgery. A variation holds in, it's sort of like super glue, holds in heart valves, hip joints, things like that. So a variation of that has about 6 million microspheres suspended in a carrier gel of ultra-pure cow collagen. So if you can have a steak, you can probably have Bellafill, but we can do a skin test first to be sure. Either way, the microspheres can clump if you're not careful. So you want to go to an injector like me, who puts lots of this material in. We do over 1,000 syringes a year and have done since, 2006.
Well over 1,000.
Yeah. So we have a lot of experience with this material. We know where we
Not we, you.
Yeah, me. Can safely use it and have had good results with it. And we certainly see people who've gone out of the country who have other things like Arteplast and Artecol and, other materials and
silicone.
Silicones and acrylamides and all kinds of other things.
It's disastrous.
Can clump up and solidify and just be a mess. And the body treats them like foreign substances and tries to build up extra walls around them, and we have to send them to a reconstructive urologist to get some of those materials out. So, but anyway, most of the time, grower to shower is a delightful evolution, and people get a great deal of both mental and physical improvement out of it, and it changes lives in a positive fashion every day. And so we have a lot of fun doing that. It's a purely elective procedure. Obviously, you want to do it for the right reasons, but generally it's just because you want to do it. The spouse or partner may reap some benefits from it, but it's basically because you want to do it. Right. Same reason you would get your lips done or any other aesthetic surgery. It needs to work well with what's going on in your head so you look and feel like what you think.
Let's move on to turtles.
Turtles. So, there has been an obesity epidemic, not just in the United States, but in the world. And certainly when guys have excess pubic fat, they can accumulate so much fat, especially when they sit down, they'll notice that the penis or the shaft of the penis gets drawn up under the pubic symphysis, that's the pubic bone, into the mound of fat until just the little head sticks out like a turtle. And with younger guys who are a little bit heavy because they've been paying too much attention to their iPad or their phone or whatever, their TV, instead of running around on the soccer field, we see that. And the cure, quote unquote, is to take away the electronics, improve the diet, get them off all the high sugar addictive stuff, and get them to move their body through space. There may be a genetic inheritance for obesity. Certainly that's absolutely probably, most likely true. But we have a lot more obesity since we got off the farms and the ranches and stuff like that, and we have a more sedentary existence. So, take that with a grain of salt, but, let your kids run. And, as they get older and they get through puberty and they start to slim down and sprout up, the penis will get longer. The shaft of the penis gets longer until their epiphyses, the ends of the bone, seal. Once they reach their maximal height, which is sometime as they come off the production line, probably in their late teens to early 20s, the penis isn't going to get a whole lot longer. So at that point, if they have fat, or as they're older, if they start to slow down and they get fat, how do we treat a turtle? Well, we can certainly add volume, but the turtle is only so long. And if there's a lot of pubic fat, particularly suprapubic fat, we do liposculpting. We take the fat out. We can remove the extra skin. If the skin doesn't have enough elasticity to contract normally, we can hide at the Dunlap fold. We can remove that extra skin, and we can do a little bit of a resuspension of the penis. So we can do a pubic lift, because the penis is normally held tight up against the body by the dorsal penile ligament. So there's a ligament of thickened tissue that goes between the pubic bone and the bottom of the shaft of the penis under the skin. Now, porn stars used to cut that ligament a little bit. That would change the angle of the dangle, and the penis would hang down between the legs, and it would have a visible length improvement of maybe 1 centimeter, sometimes 2 centimeters, but they'd have a scar going through the pubic hair. It also put the penis at risk for a fracture, because the penis, instead of being held up against the body for thrusting vertically in line with the body, now could be bent. So, when you bent it and you broke it, that becomes a surgical emergency. Thanks. Because one of the hydraulic 3-legged stool hydraulics of the corpora cavernosa, 2 of those, and corpora spongiosum, the one underneath, if those get broken, then the 3-legged stool can heal foreshortened in one side, and you get a curve. So that becomes something that you can treat if you have Peyronie's disease or syndrome, where you can treat the scar tissue there and dissolve it. We've done podcasts on that. But if you can avoid it, the long story short is, don't cut the ligament unless you have to. So, that's turtles. And
we're also seeing more with Ozempic and semaglutide and these great weight loss drugs. We're seeing a lot of people who have been obese and are losing weight. Now they've got a lot of redundant skin. Yep. And we're seeing a lot of that.
Yeah. So the gastric sleeves were one thing, but now that we've got the GLP-1s, We're seeing all kinds of weight loss. They should probably put the stuff in the water from an early age. That way we'll just stop obesity at the get-go, and we'll improve our blood sugars, and our joints will be better, and all those other things that the GLP-1s are rumored to have. But yeah, we are seeing more and more guys come in with extra skin, and they just have floppy skin kind of hanging out in the breeze. And so you lift up the flaps of skin, and look, there's a normal penis hanging under there. Hello. And a normal scrotum, although sometimes with obesity, the scrotums will become elongated, and we'll have to do a little tuck there. That's sort of a VY advancement flap, if you will, to bring that up. And, if we remove the extra skin, which is basically done under local anesthetic, and the sutures are all buried, we don't use staples
don't tell them
anymore.
That. No one will come in. We don't do anything under local.
Well, there is twilight.
You're just saying it's a simple procedure. It's a very simple procedure.
It's a minimally invasive procedure for most guys that you don't have to be.
It's not general, but we do knock you out.
You don't have to have a tube down your throat. And, we do have an accredited facility, AAAHC accredited surgical facility. It's my happy place, but taking a little extra skin off here or there is just taking a little extra skin off here or there. It's not nearly as traumatic as a body lift or breast augmentation or a facelift or something like that. It's, about as exciting as a circumcision. And adult circumcisions are not terribly exciting. They're just fun to do. So, but that does lead us to something that we're seeing with increased incidence, and it's probably 4 to 6% of the population of very young people have what's called a buried or hidden penis. But there is a percentage of adult men who have been morbidly obese that have this buried penis syndrome. And it's more recently been in the literature in the past 5 years because we're seeing more and more of it. And it's not something that physicians got trained about in med school or residency because it didn't have as high an incidence until we had reduction of morbid obesity. So what happens is it's not a turtle. It's not a turtle. It's gone. It's gone, girl, gone. You can't find it. It's down the rabbit hole. And so what happens is when a guy gets so big that his Dunlap, his pannus, hangs over and the suprapubic fat becomes engorged more and more and more, the shaft of the penis can only be spread so long. And as the surrounding tissue gets bigger and bigger, it literally envelops and pulls the skin along the shaft of the penis inside out until all you have is a buried penis with just a little hole on the outside. So you can lift the hole up and you can look down and you can see the tip of the penis. It usually is macerated and whitish. It has something called lichen sclerosus, which is treated usually with high potency steroids or high density platelet rich plasma. But first, you got to expose the penis. And sometimes that skin, like I said, is turned inside out. You may need reconstruction. So you need a reconstructive urologist to swing a graft, usually from the scrotum, adjacent skin, or from the hip. Sometimes they'll put a transplant a little bit of skin there back onto the shaft, because the skin that was there is all macerated and worthless because the guy has been peeing and ejaculating into a chamber, and the shaft of the penis, what is visible, has been living in that acid environment.
Oh my goodness.
So it takes a reconstructive urologist and a reconstructive surgeon, because they have to do a panapectomy, and then they have to anchor the penis back up where it's supposed to be and cover the penis, recreate the shaft and cover the penis. Mm-hmm. And so these guys present to the office, and because it's under-recognized, they've been sent from doctor to doctor, and they're desperate. They mentally haven't been in touch with their auxiliary brain for a year or more. They can have an erection and an ejaculation, but it's buried. And so they don't really get the satisfaction of it. And there's an incidence of stricture of the urethra, generally caused by the acid environment or the lichen sclerosus of the tip of the penis. The meatus has closed down. And so you, again, need that reconstructive urologist to be able to recreate the urethra. Wow. And have a functional urethra.
That sounds very painful.
Well, it's not. It's emotionally painful.
Well,
And, but it gets to the point where, if all you've got is, something you can't diet, if you can catch these guys before they shut down all the way, you can sometimes use dilators and high potency steroids to treat the lichen sclerosis that causes the hole to keep getting tighter and tighter. But once it tightens down, it's like phimosis, it's like scar tissue. And so you have to numb that up and surgically go in, release the beast, hope that the skin that's available will tolerate and clean up enough that as they continue their weight loss journey, they get to the point where they can have the reconstructive surgeon and the reconstructive urologist work together at the same time, but sometimes it's staged, to do a paniculus removal or revision. The suprapubic fat and extra tissue needs to go away, and that penis needs to be reconstructed, covered on the outside, and pinned back up because the dorsal penile ligament has been stretched to the point of being worthless. But almost 90% of guys that have been through this significant surgery would do it again in a heartbeat. Because they get their life back, they get their pickle back, they get the ability to truly experience the erections and ejaculations that otherwise were internal. So the buried penis syndrome, I think we're going to see more and more about in the news. The reconstructiveness, it's something that as surgeons get good at this, we'll see more of it. But as it is, only certain people are really aware of it. And even just revealing the tip of the penis carefully, letting guys continue on their weight loss journey and then get a better revision, is gratifying to both the surgeons and the patients. Wow. So, kind of cool? Yeah,
very cool. Very cool.
Anything else we should cover on?
Let's talk real quick about micropenis.
Micropenis. So, it's a statistic. And, if an average penis is 5.5, 6 inches long, 2.5 standard deviations is a pickle that's under 3 inches at its full stretch or erection is considered a micropenis. So guys who are worried out there, you may be a little shorter. You're within a standard deviation or so. But 2.5 standard deviations, if the most you've got to put out to the world is 3 inches, you might be considered a micropenis. That's a discussion for a whole nother podcast because I can't make you longer, although certain reconstructive urologists can help a little bit. That might be a reason to consider a dorsal penile ligament stretch, but not maybe removal. But we can help you with the girth. So we have had some guys who've been pretty challenged lengthwise. When they get the girth, they're good to go.
Well, this has been great information.
That's the long and the short of it, so to speak. So anyway, so thanks for joining us on this segment of Aesthetic Revolution, the podcast, where we've talked about growers, showers, turtles, and burieds. And the micros. And micros, yeah. So that really is the long and short of it. But look, listen, tell your friends, send us questions, stuff like that. And we will see you on the next segment of Aesthetic Revolution, the podcast. Thanks for listening.